Billions of taxpayer dollars are frozen right now, and, well, your state's healthcare system could be next.
Yeah, it is a incredibly massive story.
It really is. So let me bring you up to speed on the breaking news happening this very second. The Trump administration just launched a massive 50-state crackdown on Medicaid fraud.
Right, and it's moving fast.
Extremely fast.
Yeah.
Vice President J.D. Vance is leading a brand new federal task force, and CMS Administrator Dr. Mehmet Oz just fired the opening shot.
And it was a loud one.
Oh, definitely. Dr. Oz sent formal letters to all 50 governors, basically demanding a sweeping, aggressive audit of high-risk healthcare providers. And the deadlines are just incredibly tight.
Historically tight.
Right. States have just 10 days to notify the federal government of their immediate plans. And following that, they have only 30 days to submit a massive, comprehensive 2-year strategy.
Which is an incredibly short window for government work.
Exactly. And if states miss these deadlines, or, if the federal government decides their plans just aren't aggressive enough, they risk losing their federal matching funds.
And to grasp the sheer gravity of that threat, we really have to look at the financial plumbing of the Medicaid system.
Let's do that. Because it's not just a simple bank transfer.
No, not at all. Medicaid operates as a massive financial partnership between your state and the federal government.
Okay.
So the state actually administers the daily program. They process the applications, they cut the checks to the clinics, they deal with the patients.
Right, the day-to-day operations.
Exactly. But the federal government pays a massive chunk of the final bill through what are called matching funds. I mean, for every dollar your state spends on a Medicaid patient, the federal government steps in and matches it.
Sometimes contributing $2 or $3 for every single state dollar.
Yes. So when Dr. Oz and the federal task force threatened to pull that matching money, they are holding the ultimate leverage.
Because they can essentially bankrupt a state's healthcare budget overnight. Which brings us to the core mechanism of this national mandate. Because we are doing a deep dive today to unpack exactly how states are colliding with the federal government.
And to do that, we need to look closely at how the task force plans to actually catch these fraudsters and, why state leaders are hitting the panic button.
Right. So on April 23rd, the Centers for Medicare and Medicaid Services, or CMS, sent out these letters demanding a swift off-cycle revalidation.
Right. And under normal circumstances, states operate on a very predictable timeline. Like, they review and verify their Medicaid providers on a strict 5-year schedule.
So a clinic submits their paperwork, the state verifies their medical licenses, checks for any criminal history.
And then the funding flows smoothly for another 5 years.
Right.
But this new mandate throws that predictable calendar completely out the window. The federal government is forcing states to bypass that 5-year wait and immediately rescreen anyone designated as high risk.
Okay, and this is where it gets really interesting. Because the specific trigger for that high-risk label relies on something called an NPI, or National Provider Identifier.
Right.
If you go to a hospital, your surgeon has an NPI. Your primary care doctor has an NPI. It functions basically like a digital fingerprint or a highly specialized medical passport.
Exactly. It tracks their entire professional history, their billing records, and any malpractice claims.
But, and this new federal mandate suddenly casts a net over thousands of healthcare workers who do not legally need an NPI under current state laws.
Yeah, and that is exactly where the administrative gears are just grinding to a halt. Consider the people who provide community-based care, specifically personal care attendants, or PCAs.
Right. These are the hourly workers.
Right. They do not perform surgeries. They do not write prescriptions. They go into the homes of elderly and disabled patients to help them with the basic daily tasks of survival.
Like they help your grandmother bathe, or they help a patient with cerebral palsy get dressed and eat their meals.
Yes. And historically, because they do not bill for complex medical procedures, state governments never required these hourly workers to obtain an NPI.
So if an NPI is basically a digital fingerprint, and PCAs aren't legally required to have one right now, doesn't automatically labeling them high risk cast a net that catches the dolphins along with the sharks?
That's a great analogy. It's like suddenly requiring a commercial trucking license for someone who occasionally carpools the neighborhood kids to school.
Right.
They never needed the license before, but lacking this 10-digit medical passport automatically dumps these home care workers into the high-risk category under the new Oz mandate.
And being labeled high risk carries heavy administrative consequences, doesn't it?
Oh, absolutely. It instantly triggers, a requirement for mandatory fingerprinting and intensive in-person criminal background checks.
Wow.
The federal government looks at the lack of an NPI and sees a dangerous data gap. They argue that highly sophisticated criminal syndicates actively hunt for these exact kinds of blind spots.
Okay, so they set up fake home care agencies, use stolen patient identities, and bill the government for millions of dollars in services that never actually happen.
Exactly. So from the task force's perspective, demanding NPIs and fingerprints is literally the only way to ensure legitimate workers access taxpayer funds.
I mean, I understand the desire to stop organized criminals from draining the system, but if states don't currently mandate NPIs for these hourly workers, the federal government is effectively demanding data that simply does not exist yet.
Yes.
You suddenly have thousands of honest people who bathe the elderly flagged as high-risk threats just because the old state rules don't match the new federal expectations.
And when the federal government suddenly alters the rules of the game overnight like this, a state's reaction usually depends on how their leadership views the old rules.
Right. Because this federal net catches so many providers all at once, we are seeing wildly different responses across the country.
Totally, wildly different.
Let's look at the staggering situation unfolding in Minnesota right now. CMS deferred over $350 million in federal Medicaid funds.
Yeah, that's a massive hit.
And that freeze includes a massive recent batch of $91 million. But even worse, CMS is actively threatening to withhold another $2 billion.
We really need to pause and look closely at the math behind that $2 billion threat.
Put that in perspective for us.
So that number represents roughly 18% of Minnesota's entire federal Medicaid funding from the previous year.
Wow, 18%.
Yeah, and to put that into a broader financial context, $2 billion equals 2/3 of Minnesota's entire state rainy day fund.
That is just huge.
Right. If the federal government permanently withholds that money, the state faces an immediate catastrophic budget crisis.
So naturally, Governor Tim Walz responded by suing CMS. He publicly labeled the frozen funds a campaign of retribution.
Right.
But this is where the optics get highly confusing for anyone watching. Because despite launching a massive federal lawsuit, Minnesota is actually taking extremely aggressive action on the ground.
They really are. They are doing the heavy lifting the mandate asks for.
I mean, they launched active investigations into 85 different autism providers.
Right.
They completely froze new enrollment for 13 different provider categories.
Yeah, and they are currently attempting the monumental task of revalidating 5,800 individual providers.
Wait, 5,800?
Yes. And keep in mind what that revalidation process actually entails for those 5,800 people. I mean, the state cannot simply run a quick computer check.
Right, it's not just clicking a button.
No. The mandate requires them to track down these workers, bring them into a facility, take their physical fingerprints, and run comprehensive criminal background checks.
Which has to be a logistical nightmare.
It is a complete logistical nightmare for a state agency that was never staffed or funded to process that volume of fingerprints in a matter of weeks.
Wow.
And the crazy part is they even submitted a formal corrective action plan that CMS officially approved.
Okay, let me push back on this for a second because it feels completely disconnected.
Sure.
If Minnesota is actually doing exactly what the federal government wants, auditing 85 clinics, checking 5,800 providers, freezing 13 whole categories of care, they are actively hunting the fraud.
Right.
So why is the task force still freezing hundreds of billions of dollars and forcing the state to sue? Why the disconnect?
You are hitting on the core procedural friction of this entire crackdown. We have to look impartially at both sets of arguments to understand why the money remains frozen.
Okay, let's hear the Trump administration's side first.
So, from the administration's perspective, the past vulnerabilities in Minnesota's system were simply too severe to ignore. They argue that a state promising to clean up its act does not justify continuing to write massive checks today.
Like, don't trust, just verify.
Exactly. The task force views freezing the bank account as the only reliable mechanism to force a state to safeguard taxpayer money. They will not release the funds until the state definitively proves the system is completely secure.
But the critics view that exact same mechanism as bureaucratic warfare, right?
Yeah, they do.
They argue that when a state like Minnesota diverts massive resources to investigate clinics and follows the approved federal action plan, continuing to withhold the money punishes the very agencies trying to fix the problem.
Exactly. Critics see the funding freeze as a blunt weapon that ignores the actual progress happening on the ground.
So that's Minnesota. Let's cross the country and look at a state that views the federal action through a completely different lens.
Florida.
Right, Florida. Because after Dr. Oz publicly called Florida a hotspot for healthcare fraud, the state leadership did not file a lawsuit.
No, they didn't. They actually embraced the scrutiny. Governor Ron DeSantis' chief of staff, Jason Wyda, alongside Attorney General James Uthmeier, eagerly welcomed the federal intervention.
They immediately declared a strict zero-tolerance policy for Medicaid fraud. And to prove their point, they highlighted a recent high-profile arrest where a suspect stole Medicaid funds specifically designated to transport disabled children.
Right. Florida's leadership publicly agreed that the system suffers from serious systemic abuse, and they promised to deploy their state resources to root out the criminals alongside the federal CMS team.
So Florida's response highlights a very different political and administrative philosophy. They view the aggressive federal timelines not as a punishment, but as a necessary catalyst to force long overdue house cleaning.
Yeah, they see it as ripping the Band-Aid off.
Exactly. But while the politicians fight over the rules, the deadlines, and the lawsuits, we need to focus on what happens when billions of dollars actually stop flowing.
Because it's not just numbers on a spreadsheet.
No. The freezing of these funds creates a massive, destructive ripple effect that hits local hospitals and vulnerable patients directly. Let's look at the systemic strain first.
Okay.
The Minnesota Hospital Association currently reports that 30% of their hospitals are losing millions of dollars annually.
And the financial mechanism causing that strain is actually very straightforward. When the federal matching dollars stop arriving, the state budget has to absorb the massive financial shock.
Right.
So the state inevitably falls behind on paying its bills. When the state delays paying the hospitals for the Medicaid patients they treat, the local hospitals start bleeding cash.
And the bleeding got so severe that the Minnesota State Senate had to step in. They proposed hundreds of millions of dollars in emergency state-level bailouts just to keep the hospital doors open and the lights on.
Yeah, it's a huge crisis for them.
But the systemic strain goes far beyond the hospital balance sheets. We really have to look at the human toll because this is where the policy statistics turn into real, devastated lives.
It is, because when a state scrambles to comply with these aggressive federal demands, they almost always delay payments to their providers while they run the required background checks.
So they target those high-risk services we discussed earlier and freeze the cash flow for up to 90 days.
Right. Now imagine you run a small community-based care agency, you employ personal care attendants, you run adult day services, or you manage non-emergency medical transport vans.
You probably do not have massive corporate cash reserves.
Exactly. You operate week to week, paying hourly wages to your workers. So when the state suddenly freezes your reimbursements for 90 days to run fingerprints on your staff, you still legally have to pay your employees.
And your bank account just drains in a matter of weeks. You can't make payroll.
Right. Your workers are forced to quit to find other jobs to feed their own families, and your agency simply collapses.
And when the agency collapses, the patient loses their lifeline. We saw an incredibly tragic, specific example of this in the sources. A Minnesota man was found dead after he lost his in-home care services right in the middle of this exact funding crackdown.
We really need to pause and consider the gravity of that outcome. Community-based services exist to keep elderly individuals and people with severe disabilities out of large, expensive medical institutions.
Right. It's all about keeping them at home.
Yeah. The entire system relies on a very fragile network of hourly workers showing up every single day to provide basic human care.
So when you suddenly choke off the funding that pays those workers, the care stops immediately.
It does. And for highly vulnerable patients, losing that daily care is not just an inconvenience, it is life-threatening.
Which brings us back to the listener's perspective here. This sounds like using a sledgehammer to fix a watch.
Right.
If the goal is to protect vulnerable patients from being exploited by fraudsters, how do we justify a system where the crackdown itself leaves a man dead because his honest caregivers stopped receiving their paychecks?
Well, you are outlining the harsh reality of systemic policy changes, the whole bludgeon versus scalpel dilemma.
Yeah.
Aggressive fraud prevention inherently slows down the flow of money. The federal government argues they simply must stop paying potentially fraudulent bills to protect the taxpayer and ensure the program exists for future generations.
Okay, that's organizations like the Paragon Health Institute arguing that withholding funds is an absolutely necessary tactic, right?
Exactly. They point out that states often drag their feet on fraud prevention until their budgets are threatened. They argue that temporary disruptions, while painful, are the only way to force states to protect the long-term survival of the Medicaid program from massive criminal theft.
But Medicaid observers and healthcare advocates view this strategy as the ultimate nuclear option.
They do. They strongly doubt that freezing billions of dollars actually stops the sophisticated bad actors.
Because the true criminals simply close up shop and move to a different state the moment the audits begin, right?
Exactly. When you slow down the money with massive sweeping mandates, you inevitably disrupt the fragile networks on the ground.
You delay the paychecks for the honest people baiting the elderly.
You force honest, small-town clinics to close their doors and go bankrupt while they wait months for the state to clear their fingerprint background checks. The very mechanism designed to save the financial integrity of the program simultaneously breaks the daily care routines that vulnerable individuals desperately rely on to survive.
The scale of this disruption is just staggering. We are watching a financial and administrative earthquake ripple across all 50 states. Billions of taxpayer dollars are actively frozen or hanging in the balance.
And every governor in the country is on a ticking clock.
Right. They have 10 days to reply to Dr. Oz and 30 days to completely reinvent their fraud tracking systems. The federal government is demanding extreme, immediate accountability to protect your tax dollars, while the states scramble to keep their local hospitals funded and their most vulnerable citizens alive.
It fundamentally changes the relationship between the states and the federal government, and, it completely rewrites how healthcare funding flows across the entire country.
It does.
Yeah.
Before we wrap up this deep dive, I want to leave you with a final thought to mull over.
Okay.
We've examined the massive scale of the crackdown, the frozen funds, and the tragic human consequences. But consider this puzzle. States now have just 30 days to invent and launch these massive 2-year tracking systems. If state health agencies are suddenly forced to divert all their staff, all their resources, and all their attention to run fingerprint checks on thousands of honest home care workers just to meet a strict federal deadline, does that sheer administrative panic actually create new blind spots for the truly sophisticated fraudsters to exploit?
Are the agencies so busy frantically processing paperwork for the honest workers that they completely miss the organized criminals quietly picking the lock on a different door?
Exactly. It makes you wonder who actually wins when the system descends into chaos. Thank you for joining us on this deep dive. We will keep tracking the fallout, the frozen funds, and the facts on the ground.
Absolutely.
Until next time, keep questioning what you read.